Assalamu alaikum wa rahmatullahi wa barakatuh, my dear brothers and sisters and viewers of IQRA TV. Welcome back to the second part of Real Talk. Today we've been talking about Covid-19, better known as coronavirus, and how, particularly in the last week and a half, it has really impacted all communities in this country. I mean, 3 weeks ago we were talking about this, and a majority of people, including myself, we thought that we were immune to it, we were indestructible. But over the last few days in particular, we have seen the number of people dying in the Muslim community has really exploded. The spike has really gone up. And unfortunately, at the moment, the predictions are that has not even spiked yet, that the peak is yet to come. And we need to be extremely careful. The government has, for days, have been saying for about 10 days now that we need to isolate ourselves, not go out unless it's absolutely necessary. Go out only for medical supplies, essential shopping, and to work only if you cannot work from home. I have been isolating myself virtually to a large extent, and I know Mufti Sahib has been as well, who's my guest today, and we've had Shadim Hussain who's joining us from home. This is a really serious and important issue for us as a Muslim community and the wider Muslim community of humanity as well. And how we respond to it and how we take this advice seriously is important in order to protect not just ourselves but others as well. And much more importantly, the very hard-working people, the doctors and the nurses and the support staff in the NHS. We've been talking about this in the first part, not just about those issues, but about how the impact of what is happening is regenerating the community. This notion of a community, which until very recently there was no such thing as a community, as Mrs. Thatcher said, actually is now showing that people are coming together, regardless of faith, colour, creed, etc. And the community in Bradford in particular have really come together, and in other parts of the country as well. But through Shadim we've been listening and hearing some of the work that they're doing, and Mufti Sahib as well. I've got a call coming in, so I'm going to take the call. Assalamu alaikum wa rahmatullahi wa barakatuh. Please, assalamu alaikum, where are you calling from and what's your name, please?
Walaikum salam. I'm a few minutes myself that you're talking to, so it's Muhammad Akhlaq Rauf from Bradford.
Muhammad
Akhlaq Rauf.
All right, okay.
Dementia.
Yeah.
So I work around dementia. I run an organization called Meri Yaadein, it's a community interest group. So Meri Yaadein meaning my memories.
Right, yeah. I mean, obviously, this issue about, self-isolating yourself is going to have an impact, isn't it?
Well, what I'm doing at the moment, to be honest, is just putting together a leaflet. And although initially it's going to be in English, one of the biggest concerns that we have is that, actually, to be honest, where do we start from is probably the right phrase. But when it comes to things like dementia, many in our community are already facing stigma. Whether people think it's mental health, whether people think it's deliberate. But the person who is actually living with dementia will have their needs. But in addition to that, we also have a carer. So whether that carer is a family member that lives with them, or whether it's a carer who lives in a different home, could be a relative. The difficulty that you're probably going to have is how do you help support that kind of coping with the dementia?
Yes.
Coping with caring for somebody if they're mentally isolated. So I'm just putting together a bit of a resource to sort of say what kind of things that carer can do in terms of looking after themselves so that they are well enough to look after the person with dementia, and then what kind of things can they do with and for the person with dementia so they can both remain socially isolated in that respect and get through this time.
Muhammad Rauf, Muhammad Rauf bhai, assalamu alaikum wa rahmatullah. We've had you, mashallah, on our show before, but it's great to hear from you. I was just wondering what kind of advice is on that leaflet. Would you be kind enough to share some advice in this critical stage? I mean, dementia in itself, the stigma attached, Meri Yaadein, as you've just said, and the people that are suffering from it, whether their carers are there, family members are there or not. What kind of advice would you give to to our viewers in terms of this?
My first thing really would be, and this is our language, and this is no disrespect to anybody, that if we can avoid using the word suffering, because although anything can be, suffer a pain, a difficulty, there is an argument that you can live well with dementia. So it should be up to that person to decide whether they're actually suffering or they, in other words, there could be ignorance in their own kind of self of not knowing there is a problem. So if we use the language of living with, then it tells us as a community and as carers and as families that, look, that person has their human rights. Those rights are about, feeling engaged, involved, loved, supported. But if we think that they're like a patient, that, what do they know? They're a buzurg, they're an older person, got dementia. We actually treat them very differently.
Is it seen as a mental illness by many people? And that's the difficulty, isn't it?
Well, people think it's pagalpan, right? They go mad, because that's our kind of social construct of seeing something we don't understand.
Yes.
However, the physical change of it affecting somebody's brain means that there are certain things that they can't do anymore, but there are also lots of things that they can do. So, for example, if we are more at risk of having stroke because of a lifestyle, we might get vascular dementia, which will be very different to, say, Alzheimer's dementia, maybe very different to Lewy body dementia. So lots of different dementias. And my call to the community would be, look, don't get involved in what kind of a dementia it is, because some things may affect communication. Some people, so they might not be able to put, find the right word or a sentence. Other people lose their orientation. Where are they? Somebody else might be very forgetful. So there's lots of different aspects. So there's information elsewhere if they want to know about dementia, but in terms of this period of social isolation and social distancing, what I'd suggest, if I may, is that, again, as Shatman, will have discussed that in Bradford, we're trying to look at having different professionals from within the community to articulate what are our needs.
Can I say, in these difficult and challenging times, where people are being forced to isolate themselves or social isolation, how does it manifest itself in a person's lives, because they can't sort of interact with a lot of people? What are the challenges with people like that?
Well, in terms of dementia, so I'll try and stick to talking about dementia.
Yes.
Is that, first of all, there's many in our families who don't understand dementia.
Right.
Okay. So they have to understand dementia to be able to understand what is the impact. So how does it manifest? How do these problems arise in that sense? However, if you have an understanding of dementia, because if you're the family member, you will know best as to what they like, they dislike, what they will do, what can't do, want to do. In other words, how do you support that person? So my kind of breakdown would be in a couple of areas, if I can share those. And the first one is actually to the family carers themselves. Absolutely important to follow those rules. And I'm not going to here use, from a faith Islamic perspective of saying, you do this, do this. Let's look at it also from a secular perspective of, washing your hands so we don't spread germs, that isolation, so we're not, breathing over each other, and those kind of things. So the carer, first of all, must look after themselves. And what does that entail? Do they get a bit of exercise? Do they have something to, read a book, find a new hobby? Maybe if they're doing a bit of gardening or cooking. So
the carer's mental well-being is equally as important, isn't it?
Absolutely, if not more so, because they need to be well to be able to care for the second person.
Exactly.
And like I don't want to talk from a faith perspective, but and I know there is so much in our faith that actually supports that argument. However, from a practical point of view, what I'm saying is that if that person can stay well themselves emotionally, so they're not going to get depressed, caught inside themselves. They might start feeling, look, I can't handle this person anymore. It's the same routine day in, day out. So they've got to counterbalance that by doing some exercise, trying to do something different. In other words, give themselves a bit of a break from caring.
Yeah. And I'm sorry to stop you, because we'll be running out of time soon. I mean, obviously, we've seen this on our screens on BBC and Sky, etc. There's a lot of effort being put to try and provide the support network for people who are, afflicted or who have this disease. Not just dementia, but other forms of illnesses as well, or any form of disability. So, is there any initiatives taking place in this area that actually tries to overcome some of those difficulties?
I think there's lots of work happening to try and get things embedded.
Right.
But if I may, just very quickly because I know time's running out.
Yeah.
But if I may just look at it from a dementia point of view. So one of the things I've talked about, I'm just putting a leaflet together. Literally the draft format is done, which I'm trying to get Alzheimer's Society nationally.
Right. Subhanallah.
If they can put their stamp on it as well, it will give credence to the fact that, you know, what I'm talking about makes sense practically. That will happen. And the argument is that initially I want to do it in English so that, you know, younger people in the families, the carers, can actually pick information. So it's not just about having it in English languages, because many of the translation stuff is always not in the right font. But very quickly, three things. One is linking it with our faith.
I'm going to have to cut you off, unfortunately, because I've got quite a few calls. What I would like to do, inshallah, is maybe next week, if I can, bring you back on, and you can share more of the details of what you're trying to do and how that could help people in our community as well. So thank you for your phone call. And I'm going to go back to Shadim. Is it Shadim who's waiting on the line? Or do we have somebody else waiting on the line as well?
Assalamu alaikum.
Assalamu alaikum wa rahmatullahi wa barakatuh. Shadim, yeah, welcome back. I mean,
Dr.
Tahir is on the line as well, I've been told.
I have my partner with me now, my daughter Hania, who's disappeared. So obviously that was Rauf Bhai.
Yeah.
And we also, I believe, have Dr. Tahir Shaheen, who's going to join us.
Oh, subhanallah, he was on the program 2 weeks ago.
Yeah, mashallah, he's mashallah our lead doctor who's representing the Council of Mosques.
Yes.
And the important point I wanted to get across to you is that...
Assalamu alaikum, Dr. Saab, I believe you're on the line now, are you?
Wa alaikum assalam.
Dr. Saab, welcome. Welcome to IQRA TV and Real Talk. Thank you very much for your very helpful advice and guidance when we came on the program last time. How are things at the moment with the work that you're doing, both in your surgery and at the Bradford Royal Infirmary?
Alhamdulillah. So essentially in the community, we've decided a new model of working with the patients in the community.
Right.
So things have divided up into hubs. So we've got a hot hub and a cold hub. Hot hubs are for all of those patients who are suspected to have COVID symptoms, but who are self-isolating and who need some support in the community but can manage, inshallah. And then you have colder hubs where patients who understandably will still have a medical requirement, but are not suffering with any symptoms which require self-isolation. So we're taking them into the colder hubs, but still assessing them with the appropriate equipment on. So we've managed to kind of categorize things a little bit for the community. They feel safe and the practitioners feel safe.
How have you managed to overcome this issue about testing? You know, because that's a big national debate, isn't it? About testing people, whether they've got the symptoms or not.
Definitely. I don't think we've overcome that yet at the moment. As the government is promising, I think the intention is there and the total number of tests are increasing. We're definitely seeing that at the front of the hospital where the staff are now starting to become increasingly tested because certain staff who are self-isolating, we need to be absolutely certain, do they have it or do they not? Because we're going to require their assistance coming forward. So that's starting to roll in and into place at the hospital. On a national level, you know, the promise is there, so we're just hoping for that really. And I think sooner or later it'll filter through to primary care as well, so that us guys in the primary care can also sort of be tested and know where we stand.
Right. I mean, in terms of challenges over the next couple of weeks, obviously we've been told that these next 2 weeks are the most difficult ones, most challenging ones. Dr. Saab, from your opinion, what is the most important critical stuff that people need to do out there?
Well, at this moment in time, we're at a point critical, I believe. Essentially, in the sense that what we do in these couple of weeks is really going to determine how what the damage is going to be in the weeks to come. Essentially, we are still expecting some degree of a surge in the total number of people who are going to be infected, and the numbers day by day, as you can see, are slowly increasing on the mortality as well. Now, the social distancing and staying at home is absolutely crucial. Simply because the less we are out, again, it's basically going to prevent the chances of picking up infections from sources we're not aware of, taking that home and then spreading it to loved ones who are elderly and vulnerable at home. And I think looking around, looking at the statistics, at the news reports, at the traffic reports, I think there is a lot of people complying with this. So fingers crossed, inshallah. Hopefully, you know, we're in the right.
We hope so. Yes, we hope so. I mean, unfortunately, today, when the government's press conference was taking place, they actually said that there's been more traffic today than has been in the last few days. So unfortunately, we need to remind people not to be going out. But obviously, this is very important. It's very important. In terms of the medical structure and support that you have, do you have sufficient infrastructure in place now in this region, in your area, in Bradford District, to cope with what you might be facing?
So I think, again, it's all about modelling really and risk stratification. So at this moment in time, with the total numbers that are coming through, we're managing. We've got more than enough capacity. We've got equipment, we've got PPE, and we've got the staff. So alhamdulillah, for now, it's all good. What we want to do is to keep it like this. And the only way that's going to happen is if the communities and our people comply and observe the rules of shielding, social distancing, and stay at home. So inshallah, we can carry on with this.
Inshallah. Can I just ask you one final question, Dr. I mean, when you were on my program a couple of weeks ago, you actually said something that I wasn't aware of, and that was that the Asian Muslim community, or the Asian community, is much more susceptible to this virus because of the underlying health conditions within our community. And have you seen the evidence of that emerging, unfortunately, in Bradford?
Absolutely. Unfortunately, we've already had, without disclosing too much information, we've had some people who would otherwise be considered fit and well, with just maybe a touch of a bit of blood pressure. But unfortunately, they've deteriorated. We've had a death yesterday with somebody who suffers from high blood pressure and is just on one medication alone, and otherwise is considered well. But unfortunately, he's passed away now. And so these risk factors in our people are extremely, extremely dangerous. And it's all about managing that risk. So anybody with these kind of illnesses, high blood pressure, diabetes, cholesterol, they have to safeguard themselves more than anybody really.
Okay, thank you very much, Dr. Saab. That's a really important advice. And, it's something that we all need to take at heart. Inshallah, I'll call you back and we'll have you there soon, inshallah, again on my program. Saving lives, helping us to save lives, as you always do. May Allah give you even more strength and jazaya khair in this world and in the world hereafter, but not for a long time. I don't want you to be going for at least another 50 to 60 years. You're a very young guy. we need your expertise in helping to save people at the moment. So jazakallah khair. I think we're going to go back to Shadim very quickly, and then I need to wrap up the program. And I know Mufti Sahib has been very quiet. So Shadim, obviously, we've had Mahmood on the phone talking about the mental health issues, and I know he's one of your colleagues. You've had Dr. Shaheen here. He's again one of your colleagues who's worked very closely with you. I mean, we are running out of time, unfortunately. What are the key issues over the next 5 days, let's say, from your work that you're doing at the moment?
I mean, firstly, alhamdulillah, we should be very proud of our Muslim doctors in the city and also those who work in mental health. So we have a very strong role to play in this. We're both on the front line, whether it comes to the humanitarian need or whether it comes to the medical needs. So I think it's very important people adhere to the advice. Stay at home. Look after your parents, your neighbours, your elderly. If you're fit and able to do so, we can't have everybody at home. So those who are willing to volunteer, please do step up and register your details. We have various ways. There's the Bradford Council phone line 01274 431,000. There's the Bradford for Better Facebook page and apps where you can register your details. So I think for those of you who have a vulnerability, please stay at home. For those of you who are able to help, mashallah, like many of the brothers and sisters are already doing, please step up. And as this scales, we're going to really need to consider the befriending services and the bereavement support that's needed. And we're going to definitely need a lot more sisters to come forward who can support people through that difficult time, inshallah.
And mashallah, the people of Bradford have really stepped up. You've said to us that over 1,000 people have registered to help out, and I know thousands have also registered on the NHS website as well. Shadim, thank you very, very much for your help and the support this evening. May Allah bless you and your family. And we can say goodbye. Is that your daughter there in the background? Assalamu alaikum, and enjoy yourself, and make sure you're looking after your dad as well. Okay? So thank you very much, Shadim. Inshallah, we'll have you back next week or the week after to talk about these issues. May Allah protect you and your family and everybody else and give you more strength for the work you do. Mufti Sahib, obviously these are challenging times.
Indeed.
And Al-Khair is also doing quite a lot of good work. And
Al-Khair is doing fantastic work with the help of our viewers, our supporters, our well-wishers, and people like Shadim and people around the country, subhanallah. I've got some images to show you, subhanallah, from around the country, whether it's in Glasgow, whether it's in Lancashire, in Bolton, subhanallah, fantastic stuff that's been taking place in the Midlands, in Leicester, our brother Amir in Leicester office, whether it's in Birmingham or whether it's in Bradford itself, delivering essential water, food, subhanallah, many businesses, like brother Shadim said. You know, the list is endless. I could carry on mentioning businesses and names. Fantastic work, fantastic support, whether it's bread, whether it's dried, that's Bradford Royal Infirmary, where we're delivering the water there, subhanallah, last week. And, you know, this, and protect and save our NHS, whether it's support our NHS, and Allah bless you all in terms of giving and donations, my brothers and sisters. So keep on donating in terms of wherever you can, however much you can. If you can't donate, make the du'as. And more importantly, like I said at the start of the program, this is time to reflect, to ponder, to reconnect, to rekindle our iman and get more strength in ourselves in terms of Allah Rabbul Izzah, our creator, our sustainer of the universe. And that's the message we have from Al Khair and IQRA TV in terms of our connection with our Lord and our responsibility as human beings and good Muslims, inshallah.
Jazakallah Mufti Sahib, thank you very much. And as I say, obviously we live in very difficult and challenging times. It's ironic, there's a very old proverb which says, it's a Chinese proverb which says, may you live in interesting times. And some have interpreted that as it being a curse, and some have interpreted that as being an opportunity. And as we said in part of the program, you know, this is an opportunity for us to re-engage with Allah and the message of the Prophet sallallahu alaihi wasallam. You know, and if we become good Muslims, the way we are supposed to be good Muslims, and those who are businesses, you know, if you are profiteering, in my opinion, Allah mujhe maaf kare, but in my view, you're not a good Muslim. At this moment in time when people are suffering, you should not be increasing your prices. You should be reducing them and giving them to those who are less fortunate than yourselves, because there are many people out there who are really suffering, and we see them on a day-to-day basis. And people like Shadim and Inaya and all these other brothers and sisters, they're doing a fantastic job in the Bradford district. Even today there was a message out saying there's one isolated lady who's got nobody and she's living on her own. Can somebody please go and help her? Miles away from here. And there were several volunteers who were willing to do that on a day-to-day basis. And that is true Islam, and that is what we need to do. Very quickly, we're going to be facing another challenge, and that is from the extreme right. I've had an email from one of the most senior police officers of the country, who I've known for a long time. It's been on the program. And the extreme right is now using this opportunity to have another go at the Muslim community, showcasing the Muslim community as being disloyal, as being, you know, totally profiteering, not interested in helping the community. And in the Ramadan, their fear, the police's fear is that they will scale up that negative publicity about Muslims, and they want to know what we're going to be doing in the Ramadan in the mosque and the madrasas. And I've got to report back this evening to this person. May you stay safe. May you be and your families be safe, you know, wherever you may be. But as Mufti Sahib said, and as Shadim says, one of the most important things you can do is to contribute as much as you can to all these good causes, because they are doing some amazing and fantastic work. People who are going out there, risking their own lives, making sure that those who are less fortunate are not being left behind and they don't go hungry. If you can't do that, then Allah has told us very simply, agar aur kuch nahi kar sakte na, to kam se kam haath utha ke dua karo कि Allah protect us all and protect us, you know, from this virus that is going around. I hope you found today's program informative, interesting, because that's what Real Talk is about, bringing to you issues which are of importance to the community itself, issues that we need to be aware of, issues that challenge us on a day-to-day basis. So inshallah we'll continue to do that in the future. In the meantime, may Allah be with you, may Allah protect you and your families and all the ummah, regardless of what faith they are, and make dua for me and everybody else here as well. Assalamu alaikum wa rahmatullahi wa barakatuh.